How can I lower my blood pressure at 50? High blood pressure is a common problem among older people. There are different ways to treat it, including exercise, diet, stress reduction, and medications. Some of the methods are discussed below. Changing your lifestyle is an important part of treating high blood pressure. Changing your lifestyle can lower your risk of developing heart disease and stroke. Exercise. A recent study has found that exercise lowers blood pressure in people over the age of 50. While the magnitude of diastolic pressure reduction was not significantly different between the exercise groups, the reduction in systolic blood pressure was statistically significant. The researchers believe that this type of exercise may be a key factor in improving the cardiovascular health of older adults. People who engage in physical activity have a 50% reduced risk of developing hypertension. However, despite regular exercise, some people can still develop hypertension. A healthcare provider can help them adjust their medications and prescribe the appropriate exercise routine for them. While there is no one exact exercise that reduces high blood pressure, researchers believe that aerobic exercise can reduce blood pressure. Although the exact mechanism is still unclear, it appears that biochemical and neural changes may be involved. However, these changes should not be interpreted as a reduction in blood pressure. If you're new to exercise, it's best to start slowly and build up your intensity gradually. Start slowly with low to moderate intensity activities, such as gentle yoga or gardening. You can then build up to moderate levels of exercise, which will help maintain your blood pressure reduction. While exercise can help lower blood pressure, it should not replace medication. If you have heart disease, your doctor may still prescribe medication if exercise does not control your hypertension. Nevertheless, exercise is an excellent way to keep your blood pressure in the normal range, and it also has numerous other benefits. Diet. For a healthy blood pressure, a diet that is rich in fiber is essential. Fiber helps to stabilize blood pressure and reduces the risk of high blood pressure. Eat plenty of fruit and vegetables and limit the intake of salt. Sodium raises your blood pressure. Try to keep your salt intake to about 1,500 mg per day. Potassium counteracts the effect of sodium and lowers blood pressure. Foods high in potassium include bananas, avocados, and melons. Also, eat foods rich in omega-3 fatty acids. A Mediterranean diet is ideal for people who are trying to reduce their blood pressure. It contains many essential nutrients such as vegetables and fruits, low-fat dairy products, and whole grains. The diet also limits sodium and total fat to about 27% of daily calories. Studies have found that low-fat dairy products are especially beneficial for reducing systolic blood pressure. It is also beneficial to choose monounsaturated oil instead of saturated fat. Eat lots of whole grains and fruits, and avoid processed foods. The USDA recommends 2 cups of fruits and vegetables per day for adults. The amount you consume will depend on your age, gender, and health status. A diet rich in fruits and vegetables will help lower blood pressure and keep your arteries flexible and soft. Also, tomatoes and tomato juices contain lycopene, an antioxidant known to lower blood pressure. A diet high in salt is a big contributor to high blood pressure. Some foods high in salt include olives, canned soup, and tuna. However, you can control the amount you consume by adding table salt or sea salt to your meals. Caffeine can also elevate your blood pressure. However, this effect is temporary and varies from person to person. Moreover, regular coffee drinkers can develop a tolerance to its effects. Stress reduction. One of the most important things you can do for your health is to reduce your stress. It can affect everything from your mood to your blood pressure. Learn to focus on the things you can control, like your diet, and avoid situations that cause unnecessary stress. You can also learn to meditate and practice progressive muscle relaxation. Another way to reduce your stress is to cut down on alcohol. Alcohol has a negative effect on the body, as it increases the heart rate and blood pressure. Also, it can cause weight gain. Lastly, you can also practice stress management techniques to reduce your blood pressure. Practicing mindfulness meditation has been shown to reduce blood pressure in patients within 8 weeks. Medication. If you're 50 years old, you might be wondering how to lower blood pressure with medication. Fortunately, there are several medications that can help control hypertension. A list of medications and bag of supplements can help your doctor identify any supplements or drugs that are raising your pressure. Non-steroidal anti-inflammatory drugs, NSAIDs, decongestants, and certain antidepressants can raise your pressure. Your doctor may recommend alternative medications or physical therapy to reduce your dependence on these drugs. Along with medication, you can also try healthy lifestyle changes to lower your blood pressure. These changes may include eating fewer high-fat foods, limiting alcohol, and starting a regular exercise program. However, smoking can raise your pressure and should be avoided. The goal of treatment is to keep your blood pressure below 140/90.